Hello, my name is Gianni Wright. I am doing my project on global healthcare issues. I am currently a junior year nursing major at Bloomsburg University, and as a nursing major, it is important to recognize rising healthcare concerns. It is essential to be able to identify these concerns and implement them into your everyday practice. Every nurse should be aware of the most recent research on healthcare because it is our job to be able to make connections in a clinical setting. Public health should be a major concern of really all nurses because it is our area of expertise. First, let's talk about relevance. It is important for the United States to get public health under control because the risk of death from heart disease, stroke, and injuries are growing. Approximately 3 million or 12.2% of Americans have no health insurance. Many underdeveloped countries around the world lack sufficient health care, for example Africa, and requires assistance from the United States, which in turn will improve the health of the United States population because the health of Americans can be directly affected by the health of people worldwide. A good example of this would be the Ebola outbreak in 2014 that came to America all the way from South Africa. Diseases that were once abolished may return again around the world where healthcare is inadequate, which may lead back to the United States because of foreign travels and trade. This includes a lack of immunizations and proper sick precautions, like hand hygiene and quarantining when a person is contagious, for example with tuberculosis. Some things the United States needs to do to improve the overall health of its population is to promote health abroad, prevent the international spread of disease, protect the health of the United States population, and improve universal healthcare policies. As I was doing my research, I came across a very interesting statement from the Center for Disease Control. It reads, "Disease knows no borders. In today's interconnected world, diseases can spread from an isolated rural village to any major city in as little as 36 hours. The U.S. cannot protect its borders and the health of its citizens without addressing disease everywhere in the world. CDC works 24/7 to protect Americans and save lives around the world by detecting and controlling outbreaks at their source. In addition, CDC helps other countries increase their ability to prevent, detect, and respond to health threats on their own. This statement is a good example of how the United States should promote healthcare worldwide in order to improve health of Americans." Now we are going to be discussing healthcare discrepancies in the United States. The healthcare system in the U.S. is grossly inefficient for a variety of reasons. Some of these reasons include that the United States does not provide health care for the country's entire population. There is clearly a lack of adequate health insurance, which is a known barrier to accessing the healthcare system and receiving appropriate and timely care. The U.S. does not have a uniform health system, has no universal health coverage, and only recently enacted legislation mandating healthcare coverage for almost everyone. If you are uninsured or underinsured, you may be severely limited in the health services in which you have access. Medical care in the United States is among the most expensive in the world. It is the highest cost per person in the developed world, coupled with less desirable outcomes. The administrative burden placed on health providers by the for-profit tiered model system. In this system, nobody knows the true price of a procedure. Depending on where you get your health care, it's going to change. Clearly, health insurance in the United States is a growing problem, with 12.2% of Americans not having insurance, which is obviously not a good thing when it comes to the health of Americans. Many Americans will not seek health care because of this, which will obviously lead to incidental death, disease outbreak, and many other things. Now we are going to be comparing and contrasting Luxembourg versus the United States based on their health care. Luxembourg is actually the top country with the best health care. As you can see, the life expectancy in Luxembourg is 82.29 years versus the United States coming in at 78.69 years. That is almost a 4-year difference. But why? These are a few things that I found that could possibly tell us why. So, the healthcare system in Luxembourg is based on 3 fundamental principles: health insurance that is required by law, free choice of provider for patients, and compulsory provider compliance with a fixed set of fees or services. Clearly, that is way different from the healthcare model that we have in the United States, discussed on the previous slide. For example, the fixed set of fees and services. That's clearly not the same in the United States, because as you change from provider to provider, fees and services will go up and down, which also may indicate that you're not getting quality health care. So they have an unspoiled environment, medical coverage, and quality of service provided is great. In 2010, the Department of Quality Management Services conducted some research to assess how health insurance, or lack thereof, would impact a person seeking health care. And this is what they found. Socioeconomic factors, condition, age, and urgency. Patients who lost insurance and patients who changed insurance were more likely to delay seeking health care within the 4 months after visiting an emergency department than people whose health insurance status did not change. Patients who lost coverage were more likely to report no primary care provider. Loss of insurance also was associated with lower likelihood of vaccine use and checkups in the prior year. This shows that health insurance has a measurable effect on the access to health care. The United States has actually tried to make some improvement efforts on their health care system. The United States government agencies provide funding, human resources, and technical support to global health initiatives such as United States Millennium Development Goals, programs to address malaria, neglected tropical diseases, and tobacco use. The Global Health Initiative, which invests $63 billion over 6 years to help partner countries improve health outcomes. The Global Health Security Agenda to accelerate programs toward a world safe and secure from effective disease threats, with a particular focus of improving health of women, newborns, and children. And then the Obama administration launched the Affordable Care Act in 2010. The Affordable Care Act is to improve overall quality by making healthcare more client-centered, reliable, and accessible. They work to improve the health of the population by supporting proven interventions to address behavioral, social, and environmental determinants of health. And they also work to decrease costs of quality health care for individuals, employers, and government.